观众朋友们，晚上好！欢迎您收看由凤凰卫视美洲台为您带来的天天话题栏目，我是小诗。自1921年开始呢，心脏病就一直是美国人死亡的首要死因。根据 CDC 的数据，每36秒就有1人因为心脏病发作而死亡，每年有超过65.9万人死于心脏病，也就是说呢，每4个人就有1个人死于心脏病。那美国的心脏病学会呢，将2月定为美国心脏病月，呼吁大家关注心脏健康。今天我们就为您连线来自美医美医院的心脏病专科医生 Dr. Michael Cao 来了解一下心脏健康。Hello, Dr. Cao. Thanks for being with us today.
Hello, Annie. It's wonderful to be here today. Thank you for giving me this opportunity.
Absolutely. You know, it's February, American Heart Month, a time when the nation spotlights heart disease, the #1 killer of Americans. That's why it is so important to acknowledge the health of heart to ensure that millions of people live longer and healthier. How serious is heart disease we're talking about here? Actually, I know heart disease is not only the leading cause of death in the United States, it's also the greatest threat to people's lives worldwide, right?
Yes, absolutely. Heart disease is such a big problem for everyone in all age groups and every country. So I think it's so important that this month is February, which is Heart Health Month, that we talk about it.
Of course. What's even worse here is that, you know, during the COVID-19 pandemic, many people have delayed or avoided going to hospitals for heart attacks and strokes. How important is it to be at a hospital when heart attack happens, and how damaging can it be to the heart if the situation is delayed?
That's a great question, Annie. And, you know, you brought up that heart attacks and heart disease is the #1 killer all around the world. And so it's so important for people when they have a heart attack to be in the hospital. And the reason is that the heart itself needs blood. And the way we can take care of that is in the hospital to keep you alive.
Right. That's why the AHA, American Heart Association, creates Don't Die of Doubt, a national awareness campaign that reminds people that hospitals are the safest place to go when you have symptoms. So when we talk about emergency care, we always talk about golden hour. What's the golden hour in rescue of heart attacks?
That's such a great point that you brought up, Annie. And the golden hour is the first 60 minutes from when you have chest pain. That's the most important time that doctors can try to increase blood flow to the heart and try to save the muscle and therefore save your life.
Right. So the first 6 minutes are decisive, right?
They're absolutely crucial so that this way people can stay alive.
Right. So what are the options for medical management to re-establish the normal blood flow as soon as possible?
Well, like you said, you know, re-establishing blood flow is the key. And so there's 2 ways that we can do it in the hospital. The first way is we can give you a medication through the IV to break up the blood clots in the heart. But the second way, which is the most common way, is that we perform a procedure where we put a little tube into the artery in the leg or the arm, and then take a picture with some x-rays to see where the blockage is. Then we put a tiny little metal tube called stent to keep that blockage from coming back and keep the artery open. That's how we get blood flow to keep you alive.
Right, but these 2 options depend on the degree of damage, right?
Absolutely. The earlier we can get to it, and that's why you said the golden hour,
right,
the better the chances that we don't have any damage to the heart.
Right, a higher chance that the patient will survive and have less heart damage. So when we see someone having a heart attack, the absolute first thing to do is call 911. But we're seeing ambulance wait times rising during the pandemic. So what can we do at home or at the scene if someone around us have heart attacks before the ambulance arrives?
That's a fantastic question because that's usually what happens. The heart attack happens at home.
Right.
So the first thing to do actually is #1, stay calm. That's the most important thing to do. You want to help the person that needs help. So you call 911, and if you can, have them take a baby aspirin, chew it, and then swallow it if they're not allergic to it. And then after that, make sure that you're talking to them and keep them comfortable while you're waiting for the ambulance to arrive. If the person becomes unconscious for any reason, then you can perform CPR with 911's help. And these are things to do while you're waiting for the ambulance to come.
Right. And there is so much video on YouTube about how to do CPR correctly.
Yes, there is. The wonderful thing is that, you can look at YouTube and see what to do. When you also talk to 911, they'll instruct you how to do chest compressions so we can keep them alive while waiting for the ambulance to come.
Good to know. And also important to know the early signs and some common types of heart diseases, because we know some heart attacks are sudden and intense, but most are slowly with mild or discomfort, right?
Yes, that's correct. And so heart disease, what it is that there's a blockage that comes from cholesterol buildup in the arteries. And when it does that, it causes a heart attack. Right. And so this is the most common form of heart disease.
Right. So what are the early signs specifically?
Well, that's a great question because everyone, as we know, is a little different. But the most common signs are chest discomfort, whether it be a pressure or pain. It can sometimes go up to the jaw, down the arm, or through the back. Sometimes it's associated with shortness of breath. You can be nauseous, you can throw up, or just have indigestion. So there's a lot of different symptoms. And so you have to be very careful and recognize your symptoms.
And definitely don't wait to get help if you experience any of these heart attack warning signs.
That is a great point. What keeps people alive is to recognize I am having a heart problem. I need to call 911, get to the hospital. What happens is if people delay their care, like you had talked about with the golden hour, Annie, is that it could injure the heart and then therefore affect your life.
And I noticed that women are more likely to have atypical symptoms than men, right? Why is that?
That is a really good question. And, most commonly, men and women have the same symptoms. The difference is that women's symptoms may not be as severe or they may not have the chest discomfort. And there's a lot of different reasons why. Some people think that it can be related to emotional stress. Others think that it can also be not just blockages in the main arteries, but also the small little arteries as well. And this is what can account for the differences between men and women with their symptoms.
Got it. Besides the early signs, we also needed to know some common types of heart diseases. What are they?
Heart disease, like you said, can be a lot of different things. So the most common is heart blockages, which we talked about. The second can also be heart rhythm problems where you have skip beats. The third can be valve problems where there's a problem with the valve in your heart. And then the fourth is a weak heart, and we call that congestive heart failure. These are the more common types of heart problems.
What about coronary artery disease? Because we often heard about this term as well.
Coronary artery disease is a great question. And the reason is that coronary arteries are the blood vessels that supply blood to the heart. So if they end up getting cholesterol buildup, which leads to a blockage, this is what causes heart attacks. This is what we want to be able to take care of before the problem happens.
Right. CDC data shows that about 18.2 million adults aged 20 and older have CAD. That is about 6.7%, and about 2 in 1 deaths from CAD happen in adults less than 65 years old. So my question is coronary artery disease common in young people nowadays?
Coronary artery disease is common in all age groups, and we see it a lot in young people as well, because what happens is that people forget the blockage is the problem, not your age.
Right. That's why prevention is always better than cure. So is coronary artery disease easy to detect? I mean, is there a test for this condition?
Oh, that is a great question. And luckily, we have tests for that. The first test we can do is an EKG, which looks at the electrical activity in the heart. The second question is to do an echocardiogram, which basically is using sound waves to take a picture of your heart while it's still beating. And the third test, which is a really important test, is called stress test, where we can see what the blood flow to your heart is. These are the most common tests to do to look for heart disease.
Okay, but when should we do this test? Should we do it regularly on our annual physical exam, or we just need to do it only when we have symptoms or family history of heart disease?
I think that's a great question. And the reason is that everyone is a little different. So if you have symptoms, if you have a family history, if you have risk factors, these are the indications or the reasons why we should do an evaluation.
Right. So speaking of prevention, what are other ways to reduce the risk of heart attacks?
You know, heart disease can be prevented in a lot of different ways. And it's just really simple. Things that we know when we're doing. Number one, eat a healthy diet, lots of fruits and vegetables.
Yeah.
Number two, engage in exercise. Try to exercise 30 minutes a day. The third thing is to make sure that you control blood pressure, cholesterol, diabetes. And then the last one, which is really important, is try not to smoke or vape, because all those are risk factors which can cause heart disease, which we can prevent.
Right, that is not too difficult to achieve. Not only heart health, but our health in general can also benefit from these good habits.
Absolutely. These are things that we can do to take care of our health. And if we don't take care of our health, then no one else will. So it's so important that we become engaged to take care of ourselves.
All right, now we know how serious this world's #1 killer is, but there is some good news I want to share with you. A recent study from UCLA says snacking on grapes could prevent a heart attack or stroke. The superfood is rich in chemicals that can boost gut bacteria diversity and lower bad cholesterol, which leading to better heart health. Your thoughts about this study?
I think it's a great study, and it's something that we can actually do ourselves, meaning help ourselves. Grapes are a superfood. They're antioxidants. They decrease inflammation. These are the things that we can do to help. And I think it's something that I'm sure we're eating grapes already. And so now we know that we should continue to do it.
Right. And what are other good food choices for cardiovascular health?
That's fantastic, because prevention, like you said, is the key for everything. And so if we eat vegetables and fruits, we want to avoid the bad fats like animal product fat. We want to focus on the good fats like olive oil and omega-3 fish oil. And then we want to take a lot of antioxidants like vitamins A, C, and E, and folate. These are the other things we can do to help.
Right. Dr. Cao, you know, Super Bowl is coming this Sunday, and this morning I read the news says that history shows cardiac emergencies tend to surge after dramatic games, especially when your team loses, because people are easy to have emotional stress. How serious can emotional stress be harmful to heart?
Emotional stress is so important. It's been shown that any types of events that cause your heart rate to increase can cause heart attacks. So when you watch the Super Bowl, enjoy the Super Bowl, but don't let it cause you to have a heart attack.
And even if there is no study finds cause and effect, but we do know that, and also as you mentioned before, alcohol and salty fatty foods combined with emotional stress can trigger heart attacks. So what's your suggestions to fans here?
So you know what? The Super Bowl is something that we see once a year. You should enjoy it, but try to eat healthy. Eat vegetables and fruits, and try to avoid those potato chips and other things like pretzels that can cause you to end up having a heart attack.
Right. Or maybe take breaks when the players take breaks.
That's great. Absolutely. You know, the players playing hard, we're watching the game. So I think that's great advice.
Right. Well, we don't know what's going to happen during Sunday's game, but we can make healthier choices by ourselves. Well, thank you so much, Dr. Cao, to talk with us today. I appreciate your time and efforts on educating people about the health of heart, and most importantly, saving lives. Thank you, Dr. Cao.
Thank you so much. And I hope that everyone has a great new year. And this month is Heart Month. So please, let's just take care of ourselves.
Right. And go Rams.
Yes, that's right. Go Rams.
Thank you. 那今天的话，天天话题就到这里了。非常感谢您的收看，我们下期再见。祝您晚安。
您正在收看的是凤凰卫视。